Was this doctor a hero or a villain? Up to you to decide. Hola, welcome to Case Stories by Dr. Josie, that's me, where you get to hear and learn stories from the hospital. James Marion Sims was a doctor born in the 1800s and has been a very controversial doctor and was given an official name, Father of Gynecology. Today's episode, I'm going to take you back in history where I tell you how some of the surgical techniques that came to be, and that doesn't mean that they were ethical. In this case, I'm going to refer to this Dr. as Sims. So, Sims was born in the 1800s and became a doctor through his apprenticeship. So, back in the days, the process of being a doctor wasn't as vigorous as it is right now. He did a 3-month internship with a doctor and later went on to Jefferson Medical School for 1 year and was qualified, I'm putting this in quotes, to be a women's doctor, that is an obs-gyn. Let me give you a comparison of an obs-gyn then and an obs-gyn today. So today's training of being a doctor is very vigorous. You do 6 years of medical school, and then on top of that, you do 3 or 4 more years of obstetrics and gynecology for you to be termed as a consultant in obstetrics and gynecology. So that is approximately 10 years as compared to those times where it was more of an year. Hope you're getting this. So you can see the discrepancy. So Sims was a doctor in the 1800s, and he's known to pioneer a surgical technique to repair fistulas. So he practiced surgical techniques that made him famous on enslaved black women, and he did this without any anesthesia or painkillers. As I told you, he pioneered a surgical technique to repair the vesical vaginal fistula. So a fistula is a complication of childbirth where there is a tear between the uterus and the bladder such that urine leaks into the vagina, or a tear between the uterus and the anal canal, so feces may leak into the vagina. It is painful, and also because of the leakage, it causes a lot of social complications. So he was able to come up with a technique to repair this, but his methods are still questioned till today. So initially, Sims was uninterested in treating women, but during that time, he was brought a enslaved black woman who had fallen from a horse and had broken the pelvic bone. So he needed to see through the vagina to see if there were any complications into it, because the pelvic bone can pierce into the soft tissues. So during this time, during the examination, which he did using a folded spoon, actually the folded spoon was one of the precursor of the now used speculum. He discovered that this woman had the fistula, the vesical vaginal fistula, and he was interested. It now became like more of an interest to experiment, and this is how he got into it. So he will do experiments on enslaved black women. He will do this without anesthesia or any painkillers. He will tell the women to kneel on all their fours with the elbows touching the floor and the head to rest on their heads. And he will continue to do excruciating procedures for over an hour. And these women were in pain, they were screaming in agony, some used to pass out, many of them died. And his reason was that black women did not feel pain. Okay, that's some BS, because the women were screaming in agony. But during that time, it was a deep time, so that is how he did the techniques. So he experimented on black women for over 4 years, and he will do up to 30 procedures on one woman. In modern day, you can imagine 30 surgeries in one person. And he will do this, as I said, without anesthesia. He will do this on the open. He will do this in the backyard of his place. To him, the black women were more of guinea pigs, and even some of his white colleagues would dispute his ways. But at that time, no one was there to really defend the rights of the women or really defend any enslaved person of color. So after 4 years, he perfected the technique, and now later on went to do the techniques in white women and would give them anesthesia. It wasn't like the painkillers weren't there, they were there. But to him, he had this racist notion that people of color did not perceive pain. And this also, when I'm talking about this, I'm also talking to all medics. If that notion has ever been sold to you, scratch it, please, because there is no evidence or genetical evidence that has been shown that one race perceives pain in a different way than the other. So Sims was applauded for his techniques for a very long time, and had even had statues all over erected. And the latest statue that was pulled down was in 2018. We're talking about 6 years ago. So this doctor was applauded from the 1800s up until 2018. Okay, that's so recent for all. To me, they feel like atrocities, and that's my opinion. I'm not selling it, so you don't have to buy it. And he has been a controversial doctor for a very long time. Others hailing him as a hero for coming up with the technique to treat the fistula, and others saying at what cost, especially if there was anesthesia. There is no sane reason to experiment without it. So the patients, as I told you in the first episode about consent, the patients were not able to consent because, first of all, they are enslaved, and there was no documentation of really what he did or the names. Actually, only 3 names are known up to today. There is Lucy, there is Anaka, and Betsy. That's the only 3 women that are known to have, the names that are known to have undergone this. But I've told you he did this over a 4-year period and will do up to 30 surgeries in one woman. So the reason I'm talking about this is not to forget the identities of these women that were subjected to such excruciating pain. And also, I love seeing the safety in women's eyes when they approach me in such scenarios, and I assure them that we're in this together, tumetoka mbali, and it is good to see inclusion of different races and gender in the medical field today. So to you, was this doctor a hero or a villain? I would like to know your comments. Hope you enjoyed today's story. Till next time, ciao.